Welcome to my presentation on postpartum hemorrhage. My name is Malik Ganoski. I'm a first year nursing student at Georgian College. Um, so, even though birthing standards and practices have evolved over the decades via patient care and technology, women who undergo pregnancy are still at risk of postpartum hemorrhage. So, postpartum hemorrhage is typically described as bleeding in excess of 500 milliliters after vaginal birth and 1,000 milliliters after cesarean section. Postpartum hemorrhage is among the leading cause of maternal mortality and severe morbidity. Postpartum hemorrhage occurs in 5% of births worldwide. So individuals at risk of postpartum hemorrhaging, maternal age, so an increased maternal age as the bodies sometimes can't handle the birthing process. Um, a high body mass index, those who are overweight or obese, individuals who smoke during pregnancy, pre-pregnancy hypertension, um, who's pre-pregnancy hypertension, my apologies, including preeclampsia, pregnancy-induced hypertension. Signs and symptoms: uterine atony, over distended uterus, high parity, many births, cesarean birth, episiotomies, previous history of uterine atony, prolonged labor, oxytocin-induced labor, and uterine subinvolution. Sorry about that. Also, lacerations of the birth canal, trauma during labor and birth, ruptured uterus and inverted uterus, manual removal of placenta such as using forceps or vacuum, retained placental fragments, placenta previa, which is the placenta is located low in the uterus and may cover the cervix, placenta accreta, where the placenta grows too deeply in the uterine wall, placenta increta, where the placenta attaches to the uterine muzzle, uh, placenta precreta, placenta grows completely through the uterine wall, um, placental abruption, where the placenta separates from the inner wall of the uterus before birth, and coagulation disorders, where the blood has an inability to clot and stop bleeding. So I chose Curative process number 6. Um, Showing the client that the nurse has a deep knowledge of the potential health risk involved with postpartum hemorrhage, um, risk symptoms, and the ability to competently achieve optimal health and well-being for the client to achieve a positive postpartum experience. This shows the client and the family members that they're in good, competent hands and have little to worry about in an emergency situation. So knowing the signs and symptoms on a scientific basis, as well as the client's experience and implementing a competent practice of care, will allow for better overall health experience in a safe manner for the client. And one of the ways of knowing that I chose was empirical, because postpartum hemorrhage is hard to detect until the signs and symptoms become apparent. It is important for myself as a future nurse to have the knowledge and competence to achieve the highest ability of care and well-being for a client who is at risk of postpartum hemorrhaging. Imparting knowledge and teaching to the client is also important so they themselves have an ability to identify the risk of postpartum hemorrhaging. Supporting a family-centered care model, engage patient and family teaching, warning signs, excessive bleeding, prolonged local discharge, um, engage family in informed choice decision making regarding postpartum hemorrhaging in the event of an emergency involving postpartum hemorrhaging. The client and the family should be informed of procedures that ensure the safest outcome for the client. Full transparency is key. Individualized care, because no two patients are the same. Establishing a therapeutic client relationship to ensure a positive experience for the client and family members. Asking open-ended questions that detail the client and family's concerns. Having competent background knowledge, as I said before, to ensure the client and family are in good hands if at risk of postpartum hemorrhaging. Being aware of the social determinants that can affect the outcome in postpartum recovery, and have knowledge of the client and family in a holistic manner. So assessment of the patient before birth. Um, obtain an accurate history from the woman, including previous obstetrical and prenatal and antepartum history, to determine the level of risk for postpartum hemorrhaging. Timely recognition and treatment of risk factors leading to postpartum hemorrhaging in patients is key. Recognizing the four T's: tone, trauma, tissue, thrombin, evaluate contractility of the uterus. Source of continued bleeding must be identified and treated. Active management of the third stage of labor in order to prevent postpartum hemorrhaging. Signs: recognizing the signs: excessive bleeding, boggy fundus, abnormally large clots, elevated fundus level, hematoma in the perineal area, increased pulse temperature, decreased blood pressure, and a decreased level of consciousness are big risks. So one of the first things is active management of third stage labor, administering oxytocin, after the delivery of the anterior shoulder, gentle umbilical cord contraction when removing the placenta, immediate fundal massage after birth to alleviate pain and stop bleeding. So postpartum hemorrhaging and its severity are defined by estimated blood loss within 24 hours following delivery. Greater than 500 milliliters is severe postpartum hemorrhaging and needs immediate intervention. Postpartum hemorrhage can occur also within 6 weeks after birth if left unassessed and untreated. Frequent monitoring of the patient and encouraging them to void is important in preventing postpartum hemorrhaging. Monitor vital signs, circulatory status, urine output, level of consciousness, and mental status. Periodic assessment of vaginal bleeding and measure blood loss if it occurs to determine the severity. Uterine atony is the leading cause of postpartum hemorrhaging, so initial management of excessive postpartum bleeding is a firm fundal massage, expression of abnormally sized clots, elimination of bladder distension, and continuous use of oxytocin medications. Frequent assessment of fundal height and uterine tone as required, rapid administration of crystalloid solutions or blood products, or both. Apply oxygen mask if bleeding persists. Assess perineal area for hematomas or trauma from birth. Monitor for signs and symptoms of hypervolemic shock, which happens after an excessive postpartum hemorrhaging, which leads to death. So if an intervention is successful after locating the source of bleeding that caused the patient's postpartum hemorrhage, an indicator that the nursing intervention has been successful is the reduction of blood loss or complete stoppage of blood loss to allow the patient to achieve optimal healing in their postpartum recovery period. The stop of bleeding is significant because an inability to locate and prevent the loss of blood, loss of blood will result in a constant decline in health and eventual maternal death as they eventually succumb to hypervolemic shock and then death. So in conclusion, with researching postpartum hemorrhage, I've gained a greater knowledge, knowing the characteristics of individuals who are at risk before birthing and postpartum stage, knowing the signs and symptoms and risk factors involved with postpartum hemorrhage, utilization of the Caritas process, number 6, to deepen my scientific and creative ability to assist those in relation to postpartum hemorrhage, became familiar with the relevant nursing and interventions dealing with patients suffering from postpartum hemorrhage. And so as a first year nursing student, we're involved in learning the process and outcomes of pregnancy as well as complications that are involved with pregnancy. One of the issues I am certain we will face on our evolving path of nursing is the complications that can happen, but they can also be prevented given the proper education and training, rather. Upon researching the topic of postpartum hemorrhage, I will use the knowledge to perfect the craft of caring if faced with this specific issue during pregnancy. I believe the knowledge gained for this presentation, will allow me to excel in OBS simulation lab, as well as management of the signs and symptoms leading to postpartum hemorrhage, which are common. And this gained knowledge will allow me to apply proper steps in resolving issues related to postpartum hemorrhage. Thank you for listening.